Hi, my name is LaQuinta Hampton. I'm a student with Herzing University and I am a part of the Family Nurse Practitioner Program. Today I'm going to be completing my comprehensive head to toe physical assessment on Monet, who's my volunteer for today. Um, Prior to beginning my exam, I've already instructed Monet to empty her bladder, which she did. I've obtained her height and her weight. I've obtained her vital signs, and I've performed the visual test using the Snelling scale of the Snelling chart, and her vision was 20/20 according to the Snelling chart. I was testing her visual acuity, which is what the optic nerve is, which your optic cranial nerve number 2 is what I was assessing when I did the Snelling chart. Now I'm going to move on to assessing her head and her scalp and her skin. Her head is it's shaped of normal shape contour. Her hair is evenly distributed throughout her head. Her skin's clean, intact. There's no abrasions, nodules, or masses. And I'm going to go ahead and just palpate your scalp just to make sure you don't have any nodules, masses, or anything. Does that hurt? She has no pain with palpating her head. Her scalp is freely movable. Next, I'm going to go ahead and assess Monet's cranial nerve number 5, which is her trigeminal nerve. I'm going to assess which is the sensory nerve. I'm going to take several items and see if she can identify if it's a soft, dull, or sharp sensation on her face with her eyes closed. Okay, Monet, I want you to tell me with your eyes closed when I touch you if it's sharp, dull, or soft. Okay? Okay. And that was assessing Monet's cranial nerve number 5, which is intact. Next, I'm going to assess Monet's cranial nerve number 7, which is her facial nerve. Monet, I want you to look at me and follow directions. Close your eyes. Keep your eyes closed, and I'm going to try and open your eyes. Okay, open your eyes. Take in, I want you to smile. Show me your teeth. Frown. And puff out your cheeks. Alright, that's assessing Monet's cranial nerve number 7, which is her facial nerve, and it's intact. Next, we're going to go ahead and assess Monet's eyes and her eyebrows. Her eyes are evenly and symmetrical on her face. Her eyebrows are symmetrical. Her eyebrows, the hairs on her eyebrows are free of scaling. She has, let's see, I'm going to assess her conjunctiva. I'm going to pull down. Her conjunctiva is nice and pink. There's no exudate or drainage. Now I'm going to assess her upper eyelid for her conjunctiva, which is pink. There's no exudate or drainage. The sclera is white, which does not indicate that she has any jaundice, or is not an indicator of jaundice. It's nice and white. Her eyeballs are moist. Her facial expressions are appropriate. Now I am going to go ahead, Monet, and palpate her frontal and maxillary sinuses. I want you to tell me if this hurts. Okay, there's no pain with palpating her sinuses. I'm going to also palpate your temporal lobe for a pulse. And I'm going to test her temporal mandibular joint when I want you to clench your teeth and open your mouth up and close. Okay. Her joint's freely movable. All right, next I'm going to go ahead and test Monet, assess Monet's ears. Now her ears, external ears are clean. They don't look like they appear to be occluded or have any masses, nodules, or lesions on them. I'm going to palpate her auricles and her earlobes. The external ear looks good, so now I'm going to go ahead and move to her assess her inner ear and middle ear with the otoscope. This is assessing the vesicular cochlear nerve. I'm going to go ahead and actually turn your ear. Since Monet is a child, I'm going to pull down and back so I can get a good look at her eardrum and her middle ear. Alright. Monet's middle ear, her eardrum is nice and shiny and silver. There's no fluid. Her eardrum is nice and concave. There's no fullness to her eardrum. And same with her left ear. Her eardrum is nice and full. There's no there's no fluid behind her ear. There's no redness or irritation to either ear. Now, Monet, I'm going to assess your hearing by doing the whisper test. What I'm going to do is, and that's assessing the cranial nerve, the vesicular cochlear nerve. I'm going to stand behind Monet. I'm going to ask you to cover one of your ears, and I'm going to whisper something to you, and I want you to tell me what I whisper to you. Okay? Close your eyes. Okay, occlude one of the ears. Press the inside of your ear with your finger. There you go. All right. 2, 4, 6. What did I just say?
2, 4, 6.
Okay, cover the other ear.
179.
That was assessing Monet's vesicular cochlear nerve, and it is intact. Now I'm going to move to Monet's nose and assess her inferior and her turbinates, her septum, and her nasal airway for obstruction. Monet, what I'm going to do is take the pen light and I'm going to actually tilt your head back a little bit, and I'm going to look inside your nose. Okay. Put your head back. You put that too far back. There you go. Alright, Monet's turbinates are nice and pink. She has no septal deviation, and her airway is patent. Now I'm going to be accessing Monet's cranial nerve number 1, which is her olfactory nerve. Monet, what I'm going to do is ask that you close your eyes, and I'm going to put something underneath your nose, and I want you to tell me if you smell it. What did you smell?
I smell coffee.
Okay. That was assessing Monet's cranial nerve number 1, her olfactory nerve, and that was testing her sense of smell. Now I want Monet to cover one side of her nostril and breathe in and out. Do this for me. Breathe in and out. Now occlude the other nostril. Okay, very good. That's the end of assessing Monet's nose. Now I'm going to assess Monet's mouth and her pharynx, her pharynx, her mouth, and her uvula. I'm going to put on gloves for this. What I'm going to be assessing at this time is Monet's hypoglossal, glossopharyngeal, and vagus nerve. The vagus nerve is assessing her gag reflex, and the hypoglossal and glossal nerve is to assess her alignment of her tongue and the inside of her mouth and her swallow reflex. Open your mouth. Ah. All right. Her hard palate and her soft palate is nice and pink. Say ah. Stick your tongue up. Stick your tongue up. Ah. Say ah. Okay. Her uvula and her tonsils are nice and pink. Her tonsils are at a stage 1. Her hard palate is nice and pink. I'm going to look in her oral mucosa and just kind of feel around for masses. I'm going to lift up her upper lip. She has no masses, sores, nodules, or lesions. Her lower lip Her oral mucosa is nice and pink. Open up. She has no nodules, masses, or lesions on the inside of her mouth. Stick your tongue out. Her tongue's nice and aligned. Her teeth are all intact. She doesn't have any missing teeth, caries, or dentures. Okay. If I were to perform this on someone who had dentures, I would make sure that they take the dentures off. Out of their mouth, I'm sorry. So Monet's hypoglossal, glossopharyngeal, and vagus nerve is intact when they swallow for me. Okay, that concludes my assessment of Monet's mouth, throat, tonsils, and pharynx. Now I'm going to assess Monet's neck. I'm just going to take a little peek at all aspects of her neck to make sure that her skin's intact. I'm going to make sure that she doesn't have any rash, sores, or bruises. And she does not. So now I'm going to take and palpate your neck, okay? What I'm doing is just feeling for any nodules, masses, or anything. Does that hurt?
Yeah.
Okay. Now I'm going to assess Monet's lymph nodes. This is the pre-auricular, post-auricular, occipital, submental, submandibular, tonsillar, supracervical, posterior cervical, deep cervical chain, and supraclavicular lymph nodes. Monet, what I'm going to do now is access her accessory muscles, which is her cranial nerve number 8. Monet, what I want to do is I want you to put your head to your chin, put your head back, turn your head from side to side. I want you to take one shoulder and try and reach your ear. Okay? And I'm going to take my hands, put them on your shoulders. I want you to try and push up while I push down. Okay? Push up. Okay? I want you to put your arms out. And I'm going to push down on your arms. I want you to try and resist. All right? Go. Look. Push down. There you go. That was assessing Monet's cranial nerve, her spinal accessory muscle, which is intact. Now I am going to move on to assessing Monet's posterior thorax. I'm going to move around to her back. I'm going to be just taking a look at her back, making sure that she doesn't have any problems breathing. Make sure she doesn't have any asymmetry in her effort. She's not labor breathing. She's breathing normally. So now what I'm going to do, Monet, is, and her skin on her back, her spine, I'm going to touch back here just to tell me if you have any pain, okay? Okay? No pain?
Okay.
Okay. Now I am going to palpate Monet, and I'm going to test for tactile firmness. Monet, I want you to tell me if you have, I want you to say 99. Hold your head straight. 99 while I'm palpating your, checking for tactile firmness.
99.
Okay. Now I'm going to test Monet for, I'm going to percuss to see, make sure I don't feel any dullness. Don't move Monet. I'm going in a systematically side to side. Don't move. Okay. Now what I'm going to do is test Monet's lung expansion by putting my 2 hands on her lower back at her T10, and I want Monet to breathe in and out. And what I'm checking for is expansion with her inhaling and exhaling of my thumbs. Okay. Breathe in. Breathe out. Breathe in. Breathe out. One more time. Breathe in. Breathe out. All right. Good job. Alright, next I'm gonna listen to Monet's lungs and all of her lung fields. I'm gonna listen to see if if she has any crackles, wheezing, bronchi, or if her breath sounds are just clear. Breathe in and out. In. Out. Very good. Okay. So now what I'm going to do is move back to Monet's front, and I'm going to assess her anterior chest and thorax. I'm looking for her respiratory effort, which is normal. She doesn't appear to be in any type of distress. I don't see any stridors, wheezing. Notice any of that with her normal breathing. Her chest and her nipples on her breast, it seems to be symmetrical. Her head is aligned with the rest of her body. Monet, what I'm going to do too is listen to you. I'm going to feel for your carotids. And I'm feeling for her carotid pulse just to make sure she has a comfortable carotid pulse. And then I'm going to take my stethoscope and listen for bruits or thrills on her carotids. Okay. Next, I'm going to go ahead and do the same thing that I did to her posterior, and that's just assess her chest. Her skin is intact. She has no lesions, masses, or bruises. I'm just going to touch Monet and just tell me if you have any pain or anything on your chest while I palpate. Any pain? Okay. What I'm also going to do is check her tactile firmness from her anterior aspect. I'm going to put my hands on your chest and I want you to say 99. Say 99. 99. 99. Okay. Alright, now I'm going to check and percuss for any dullness. Okay. Now I'm going to listen to Monet's lung field just to make sure I don't hear any bronchi rails, wheezing, or anything abnormal with her lungs. Breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. In. Out. In. Out. Time. Breathe in. Okay. There we go. Alright. Now that we're done assessing Monet's lung and her anterior chest, I'm going to go ahead and listen to her heart. I'm going to be listening to her heart with my stethoscope. I'm going to listen at the aortic, pulmonic, tricuspid, and apex. I'm listening for any murmurs that may be present. Her heart sounds are good. There are no murmurs that were auscultated. Now what I'm going to get Monet to do is I'm going to assess her arms. I just want to feel and check her temperature. Her temperature is nice and cool. Her skin's nice and moist. You see the inside of your hands. Her nail beds are nice and pink. Her capillary refill is brisk. And that +2. Monet, can you take your hands like this and do like that for me again? I'm just trying to see if her muscles in her hands are functional. Now what I want you to do is I'm going to ask you to lie back on the bench. Okay. I want you to turn your head that way. What I'm doing now is assessing Monet's jugular vein for distension. Make sure you have good lighting. I can see her jugular vein pulsating, which means that her jugular vein is intact and it's palpable. Okay. Turn your head straight. Alright, now I'm going to feel her apical pulse. I'm going to put this up, assess her apical pulse by palpating and putting my hand over her apex. And I'm going to assess by feeling her, put your hands to your side, her aortic pulse. Okay, Monet, I'm going to pull your shirt up a little bit, okay? Now I'm going to assess Monet's abdominal muscles. I'm going to palpate. Her skin looks really good. I don't see any visible masses or anything. So I'm going to go ahead and just kind of do a soft palpation on her abdomen. Just makes it a little bit. Okay. Now I'm going to do a deep. I'm trying to feel for her liver. Now I'm gonna percuss Monet's liver so I can feel for downness to locate her liver. Now I'm assessing the feel for Monet. Okay, Monet, now I want you to turn to your right side for me. Right side. On this side. Turn on this side. Now I'm going to percuss her spleen to make sure. Put your hand on me. There you go. Okay. Back on your back. Alright, now I'm going to listen to Monet's bowel sounds. I'm going to listen in all 4 quadrants to make sure she doesn't have any abnormal bowel sounds. Okay. Her bowel sounds are really good. They're not hyperactive or hypoactive. Okay, Mommy, I want you to sit up for me. Alright. Next, I'm going to assess Monet's trachea. I just want to make sure that her trachea is midline. There's no deviation in her trachea, so hold your head straight. Trachea is definitely midline. Swallow for me. Okay. Now I'm going to assess Monet's brachial and radial nerve. I'm going to do that by palpating her brachial nerve to make sure she has a pulse. Okay, good brachial pulse. Radial. Good radial pulse. Thank you. Okay, now I'm going to use the reflex hammer and assess Monet's brachial and radial reflexes. I'm going to press on her brachial muscle and look for brachial contraction. And what I'm looking for when I test her radial reflexes is I'm looking for flexion of her thumb. Now, Monet, I want you to come sit up here for me. This is, I'm going to be testing Monet's, there you go. I'm going to be testing Monet's quadricep quadricep reflexes and her Achilles tendon reflexes and her Babinski reflexes. What I'm going to do is put my hand on her thigh and I'm going to hit her patella. This is testing for her quadricep reflexes. Okay. Now I'm going to assess her Achilles reflex by hitting her Achilles tendon. Alright. Now, Monet, what I need you to do for me is get back over here for me and lie down. Alright, I'm going to test Monet's muscle strength. And I'm going to test for any pain to her calf. So Monet, bend your leg for me. Alright. Bend, flex your foot up. Do you have any pain in your calf? This way. Do you have any pain in your calf? Okay. Now I'm going to test Monet's plantar reflexes using the opposite end of my reflex hammer. This is testing for her Babinski. And I'm looking for a flexure when I move the, there you go. All right, her Babinski reflex is intact. Now, Monet, what I need you to do is stand up for me. Hold your arms out. Close your eyes. And I want you to touch each one of your nose, touch your nose with one hand at a time. There you go. One more time. Okay, stop. Put your arms down. I'm testing for her balance. Now I'm testing for her swaying, which is good. Okay, you can open your eyes. Now I want you to walk that way and walk back for me. Turn around. Walk back. Okay. Now this is testing Monet's motor strength and muscular ability. Let's see. All right, Monet. What I want you to do is turn around, and I want you to bend down and touch your toes. I'm going to be looking for any spine issues. I'm looking for kyphosis or scoliosis, which she does not have. No curve. She doesn't have a curvature to her back. Okay, you can stand up. All right, and I think we've pretty much covered everything. I just want to just kind of run through again what I did assess. Her olfactory nerve, which was a cranial nerve number 2, which is assessed for sense of smell. Cranial nerves number 3, 4, and 6, which was her oculomotor, trochlear, and abducens nerve. That was testing her visual acuity, her pupillary reaction to light, her visual fields. Trigeminal nerve number 5 was her testing her sensory nerve, which is her sense of touch to sharp objects, soft objects, or dull objects. Also testing her facial nerve, which was trigeminal number 7, and that was when I got her to puff out her cheeks, close her eyes, smile, frown. I also assessed her her cranial nerve number 8, which was her accessory spine accessory muscles, was when she shrugged her shoulders and not put resistance. 9, 10, and 12 was her glossopharyngeal and vagus nerve, and that was assessing her gag reflex. Her alignment of her tongue and her tongue movement. And pretty much that concludes my assessment. Thank you, Monet, for being my volunteer. My name is LaQuinta Hampton. I am a student with Herzing University, and I am a part of the Family Nurse Practitioner program, and this concludes the end of my comprehensive physical assessment. Thank you. I also forgot to add to my assessment that I had to do a little teaching. Monet is a preteen, so I just wanted to kind of talk to her about body changes, body issues, make sure she's getting enough diet and exercise, and not, playing on the games and things like that. So, Renee, what type of activities do you do? Do you go outside and play, or are you mostly inside on the game or your tablet? You go outside and play. So that's a very good thing that you go outside and play because that means that you're active. So you want to stay active. You want to make sure you're eating healthy foods. Junk food and stuff like that is not always healthy for you, okay? So make sure that you keep up the good work with diet, exercise, okay? Thank you. All right.